quick trivia, because a lot of the kit is really designed around endo compliance. It's an endo specific kit. Has anyone used our kit before?
ACC, yeah.
Okay. Okay. So it's a little different than what ACC uses, but to get us warmed up, and I know that you guys don't reprocess the scopes, but I'm going to have you guys put these steps in order of reprocessing. Do you guys know it at all?
No. I don't know anything.
RT.
No, I don't
test with this thing, right?
Clean, but I don't know leak in this thing.
So you guys can work as a team. But I'll give you, okay, so
You want the beginning?
there's two transports. So the first transport is going to be transporting the scope.
Oh my god, just press through.
Visual. No, maybe this one first. Okay.
Where's the procedure? So this is right when the scope out?
Oh, so this is bringing it to the room.
Yeah, so this
transport
is
it
transport
to
to the room.
And then you
Procedure would be like, yeah.
and then
Transport inspect.
No.
Inspect and then put. We look for it before we take it,
Or
right?
do you pre-clean and then you look at it to make sure that it's good, properly cleaned? Manual cleaning?
Manual clean.
What, manual cleaning?
Wait, I thought pre-cleaning. No,
Pre-clean is the bedside clean.
the manual
If that
cleaning is
helps
the
out.
one that they do a CSP.
Good job, Gia.
My one contribution, okay.
And honestly, I know you guys don't do it, so I don't expect you to know it, but
Is there a number in the back so we know?
Pre-clean.
Yeah,
Transport, manual clean.
we are pre-cleaning.
I'm gonna give you a hint. Leak test is not in the right place.
Yeah, we don't do leak testing.
leak test is earlier than you would think.
Even drying, who dry this thing downstairs, right?
Yes.
Yeah, so.
Yeah.
That's pretty good, guys.
All right, so I'm gonna call it out.
No. Sorry, yeah, sorry, last one. It go from here to here.
Okay, so it's pre-clean. Well, transport is true, and then so the transport goes between. There's two spots where you're transporting the scope. One into the room,
And out.
and then one from the bedside clean to where you do the cleaning. Leak test is after transport. Manual clean, visual inspection, HLD, drying, and storage. Boom. So that's the whole process of cleaning the scope. And honestly, it looks really simple when you put it into these little steps, but really in each one of these steps, there's probably 20 or so different steps that they have to follow down in
One of us.
So, along with that, there's
You
a
still
ton
have to
of
send two, though.
basically different guidelines that people can follow.
One of us.
Do you guys know if you guys follow AME, SGNA, AORN? Do you guys know which guidelines you follow? So there's a lot of variability too in even what guidelines you follow. You have to follow the OEMs, like Olympus's instructions or Fuji's instructions for the scope reprocessing. However, when it comes to certain bedside clean aspects like that, you can honestly, a lot of people choose to follow different guidelines, whether it's SGNA, AORN, or AME. So the point is, there's a lot of variability in which guidelines you can follow. It can make it very confusing. But we're going to kind of go over the kit that we have is basically designed to help streamline that, make it really easy to follow the guidelines. So I'm going to go over it piece by piece here. So because it's a really quick in-service, I'm going to go over these steps. So these are different guidelines that will help make you guys compliant. If leak is found, it will be sent out for repair. The scope. Where would this go in all of these steps?
Leak testing.
Yeah. Use closed biohazard labeled container. Transport. Done within 60 minutes of the procedure.
Pre-cleaning.
No, send it down, right?
Manual cleaning.
Manual clean. And does everyone understand why that is?
Like those bacteria sits there.
Yeah, so biofilm can form, and so I kind of think of it as like if you are cooking pasta, right? You have sauce in the pan, you let the pan sit for 6 hours, you're probably gonna have to let it soak, clean it a little bit extra, whereas if you wash it right away, it'll probably come right off, right? So that's the same thing with a scope, to put it in layman's terms. Use freshly prepared detergent. This could kind of go in two of them, but yeah, pre-clean. And then use an air water cleaning adapter, flush for 30 seconds, and then flush with air for 10 seconds. Pre-clean. 10-minute flush of air.
Drying.
Drying. I think that's in the drying cabinet. I haven't looked at this actually in a while. Does anyone remember when you guys used to use reprocessable buttons? Like I think you still do for like EUS. So those actually require traceability with the scope. You're supposed to keep the buttons with the scope throughout the entire time. So a lot of people don't know that. And then okay, we'll get to that because none of those are as relevant to you guys. So the kit is made to basically help with all of this and help you guys stay compliant. So there's a few different things. The kit that you guys will try is a pretty simple kit, much like ACC uses, just without the cleaning brush, and with one added piece to it. So I'm going to go over it kind of piece by piece. EcoBowl, this is recyclable if anyone cares, or if you guys do recycle in the rooms at all.
We're gonna start a project on that.
Okay, so these are recyclable. They're made of recyclable materials. There are fill lines on the side of the bowl, so that helps with the bedside clean for whoever's doing that. 100, 300, 500, 700. I think you guys usually suction the 500 milliliters of water. You can also use it during the procedure. It has a square base for a reason. That's just for stability. Biohaz, you guys won't be using the cinch pad for transport, but if you ever did, or if you ever have to put it on anything, this is like a non-negotiable. It comes in every kit. Who has used our Koala sponge? So this is an enzymatic sponge. It's shaped like a circle. If anyone, even I think the Ruhoff ones are, it's shaped like a circle for a reason, so it basically adheres to the scope as you go all the way down. Ours has an enzymatic in it. Enzymatic is different from detergent. Does anyone know why or what the difference is?
Breakdown.
Does it break down?
Kind of. It's basically meant to be more effective for scope cleaning. So the detergent will often have bubbles. Like when we're doing our dishes, it is nice to see bubbles, right? We feel like we're getting our dishes really clean. An enzymatic does not bubble, and so that's basically as you're cleaning the scope, it doesn't leave any room for little air bubbles for biofilm to form. So it's supposed to create a much smoother clean and adhere to the scope surface. A lot more than something with a ton of bubbles for. So to activate the enzymatic in the sponge, you'll give the sponge a few squeezes in water, and you won't see bubbles, but the enzymatic is there and it's doing its job. The no bubbles is actually a good thing when it comes to infection prevention. So a few squeezes, do the scope. Some people leave this at the tip of the scope. I can't remember as they transport it, just to protect. That's the most expensive part of the scope. So some people will leave this covering the tip. Let's see, lube. This is an endo-specific lube. You guys may still keep extra lube probably on the shelf, as would you with the gauze. But this is basically a more viscous lube. It's not a surgical lube, so it's going to be less drippy from the endo cart to the patient's mouth. So it's designed specifically for endo, and basically and they did benchmark studies and said this was like the perfect amount for an endo procedure. Now, for like a 4-hour procedure, I don't know, but you get the point.
Yeah, we're gonna switch.
Probably the biggest difference is Porpoise. So this is the air water cleaning adapter. So this actually would replace the reusable credit card that you have. Like I said, so about 10 years ago or so, everyone was using reprocessable buttons. There was a shift. Does anyone know why that shift would have happened? What the point of it was? Is to cut down on cross-contamination between patients. So especially, yeah. So And they've done studies where they look at buttons and cleaning adapters, things that have been fully reprocessed, and they actually found that up to like 56% were still contaminated. So that's why they switched to reusable buttons. It's the same reason why you see reusable credit cards on the market. Disposable credit cards on the market. So it's the same flush that you would do the 30 seconds of water, 10 seconds of air, and then 30 seconds of water. And then some people will leave it in the scope as it goes down to let them know that they did the bedside clean. If that doesn't follow your guidelines, feel free to just toss it. But it feels a little different. It doesn't feel quite like the button would or the credit card, but it's doing the same thing. It has the same amount of water flow and airflow.
And that's a disposable credit card?
Yes.
Okay.
For all the scopes, even EOS?
Not Fuji scopes, for all Olympus scopes. Well, for the 160s, 180s, and 190s, so not EUS. That would still
Not
have.
EUS.
Yeah, so we're actually working on one for both Fuji and that. And then the last thing, the cinch pad. So it is leak and puncture resistant, so it is going to be a lot more durable than a chuck. Again, basically made to make your life easier. You can use this for transport. It counts as hard transport. I don't think you will, but it does meet the guidelines. I know you guys use the actual hard bins. And if you ever do have a scope in here, if it's within this kind of white and blue part, it's going to protect the scope from damage. So it's designed for the perfect shape of a coil without damaging the scope. And if you ever are transporting anything, it goes side over side, and then the two blue strings cinch, and then slap a biohazard label.
I think likely if we switch to these, we probably won't use so we'll just cinch it all up to throw it away, because I think we're still going to use our Oasis transport boxes.
Yeah.
This would be fine if we had, the alternative to our red cart is like a more surgical cart that has trays that pull out, and you could put that in the trays, but we don't use that cart. So we're
Yeah.
probably going to stick with our Oasis boxes.
Are we
Okay.
opening that only when we start cleaning? We're not using it like ahead of